Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we welcome Rachel Litchman. She's a writer and a homeless services consultant. Today's Kevin MD article is Top-Down Hierarchies in Healthcare Harm Patients and Healthcare Workers Alike. Rachel, welcome to the show.
Thank you, Kevin.
So let's start by talking about the story that you shared on Kevin MD for those who didn't get a chance to read it.
So I had a recent hospitalization, and I wrote about some of my experiences during that hospital stay where I interacted with a lot of people in the medical system, nurses, CNAs, doctors, and I found myself not necessarily surprised, but feeling seen as a lot more human by folks in the healthcare system who were lower on that healthcare hierarchy. And so I wrote about some of those experiences and also some of the really not so great experiences I had throughout that hospitalization, where I felt that people who were higher on that chain of authority really overlooked me. And that led to some pretty significant consequences for me, especially upon discharge, when I was discharged essentially into homelessness because I couldn't get up the stairs of my apartment.
So tell us about that hospitalization. Just tell us your story for those who didn't get a chance to read your article yet.
Sure. So I have several chronic health conditions, and around like late July, I just noticed things were getting a lot worse. I ended up just standing up and getting really severe hypertension. And that would happen pretty much every time I stood up. And then that led me to basically collapse on my floor. I had all these electrolyte disturbances. I got really, really weak. And so I ended up admitted to the hospital after that. And I was so weak that I was not able to walk.
Mhm.
So after that hospital stay, I was then discharged to a physical rehab facility. In the physical rehab facility, it was a acute care rehab facility. So those facilities tend to be like 2 weeks maximum. And while I was there, I was still really struggling to make progress and to be able to walk. But because of that 2 week stay and because my insurance was being very difficult and not wanting to cover the stay after 9 days, the rehab facility said, we got to discharge you, even though they knew that my apartment had 20 stairs and I wasn't able to get up those stairs. So I said, okay, like we can try to figure out a plan. But then the day before discharge, I got hospital acquired COVID.
Mm.
So I was too weak to even get up the stairs on with my arms because that had been the initial plan was that I would scoot up the stairs in my apartment with my arms, but I was too weak with COVID to even do that. So I ended up just going to a hotel after discharge because I couldn't even get it up the stairs in my apartment. And then after that to a friend's place until I was recovered enough from COVID to get up the stairs in my apartment. So that's what happened over that month and a half. In
So tell us
July,
about some of the
September.
interactions that you had with the spectrum of healthcare
Mhm.
workers during your hospital stay.
Yeah, so I think one of the initial experiences I had were in the ER, and there was this nurse who I was just so I'd been hospitalized in 2020, and I was shocked by just how much the healthcare system had gone downhill since 2020 because I'd been in that same emergency room.
Mhm.
And I remember in 2020, it was like, I was able to be seen pretty quickly. And this time I would just put it in a hall bed in the emergency room. And I was in the ER for over 24 hours because they had no beds upstairs. And it was impossible to even see a doctor. And so there was just this nurse entire time. And I wasn't even really like assigned to somebody. But she was really, I think, the one looking out for me because I had to be catheterized and doctors have to put in like orders for that
Mhm.
and no one was really paying attention to the fact that this was like very, very urgent. So there's this nurse that was really looking out for me and making sure that happened because the doctors just were not getting to me in time and things were getting pretty severe with my pain, with needing to be catheterized. And so I think that was one of the first interactions where I felt very helpless, but I
Mhm.
felt seeing that there was this nurse looking out for me when other folks on my care team were not. So that was, I think, one of the first interactions that really stuck out to me. And then I think the second one was when I was being first second like when I was in the hospital, I was having a really hard time after they gave me this medication called compazine.
Mhm.
It had some psychiatric side
Hmm.
effects, and they did not warn me about that. And so I started to feel very, very anxious after they gave me this med. And I told a nurse, I said, "Hey, I'm feeling very, very agitated right now. And it happened after I took this medication. Is there anything I can give for anxiety or anything?" And the doctor's like, "No, no, no, we'll just wait till it wears off." But this was like, happening for 7 hours. I was still feeling extremely agitated. And this nurse was basically just like begging the doctors, "Hey, can you just give her this like med?" And I was like, "No, no, let's just wait till it wears off." Finally, after 7 hours, they're like, "Yeah, you can give her a med for anxiety." They gave me the med, and things immediately got better.
Hmm.
And so I think that was again one of those situations where it was people who were closer to me and also lower on that chain of authority were able to help me better and were able to see what I was going through better and hear me more than doctors and people who are higher on that chain of authority who are more detached from my care. And so I think so those were I think a couple experiences I had. And then in the rehab hospital, there were just several conversations I had with CNAs, people who were just cleaning the room, a lot of people who just didn't even want to be in healthcare but were just there because they needed a job. And I think there was I think a lot the conversations we had were a lot more humanizing. I think
Hmm.
just being able to ask about who we were and see they learned about me, I learned about them. Whereas I think a lot of those conversations never really happened with people who are like my doctors or case managers. No one really asked about like, "Hey, what do you do for work? Why are you here? What happened?" It was sort of just kind of to the point and like, "We need to get you out of here because your insurance won't cover anymore."
Hmm.
Those were a couple of the experiences that I had in both those.
And after you had some time to reflect on these experiences, why do you think there was such a big divide between your experience from people in lower authority versus those in higher authority?
I think a lot of it just has to do with power dynamics
Hmm.
and a feeling of powerlessness. I know for me and a lot of the nurses and CNAs, I think there was this shared feeling of, you know, there's only so much we can do, and
Hmm.
there's only so much that we can say and that will be heard. And so I think there was this kind of mutual understanding of like being really in the thick of it and being able to see firsthand what it feels like, what it looks like to really be suffering and going through these experiences. Or a lot of times the doctors aren't even they're not in the room when a lot of these like medical crises are happening. They're just kind of giving the orders.
Hmm.
And so I think that's also part of it. There's also just socioeconomic differences, I think, is one of the big ones too. In that I think for me as a patient who was going through, well, my hospitalization, it was related to my health, but it was also related to the fact that I couldn't get up the stairs of my inaccessible apartment. And so there was this like socioeconomic divide where there was this social factor involved. And that was something that I think people who were lower on that chain of authority were better able to understand and had maybe experienced themselves as just this, I guess, understanding that there's sometimes social factors outside of your
Hmm.
control that can lead to hospitalization and can lead to health crises, and those things are just as important to acknowledge, and they're not necessarily in the patient's control. Or sometimes I feel like sometimes if you are not experiencing those things like housing instability and maybe you're a doctor, there's a level of blame that happens, like, "Oh, why are you in that situation?
Hmm.
You can just go home, like you'll be fine." And so I think sometimes there's this disconnect when there's not this understanding of also like socioeconomic differences and how those can contribute. And a lot of time there's this feeling of shame that can happen from folks in the healthcare system who aren't living through that experience.
Now, while you were hospitalized or in a rehab facility, was there any resource that you could turn to, like a patient advocate, where you could express some of your concerns to?
Honestly, not really. I think that the thing that happened a lot was I'd be, like I said, I have this housing situation where, I can't get into my apartment, and they'd be like, "Oh, just get accessible housing, Here's this resource list of like 10 organizations that do accessible." I'm like, "Yes, I work in services. I've contacted all of these organizations, but you don't understand. 3 to 10 year wait lists for
Mhm.
like all of these places. And so I think, and I remember just being, there was this like when the case manager gave me those resource lists, and I had to tell her, I was like, yes, I have contacted all these organizations, I'm on all their wait lists. And she was just kind of in disbelief, like she seemed to think that I had not been trying hard enough.
Mhm.
I think there is this level of disconnect where if you're not someone going through that experience of trying to find adequate housing, find accessible housing where you don't have enough income to pay the like $3,000 rent in the city, it's really hard to understand that a lot of times resources just don't exist for people who are disabled, poor,
Mhm.
and I think that's really hard for people who haven't experienced that to understand. Is they're like, oh well, I know this organization that exists that does XYZ. How come you can't get help? And I think they don't understand that like these organizations exist because the system is fundamentally not working, and people have to go to these organizations in order to get triage just the same way they would in a healthcare system. And oftentimes there aren't even enough resources. Most of the time, there aren't enough resources even when you go to these other nonprofit organizations for
Mhm.
help. And so that was, I think, a big barrier that I faced is yes, I did have people who were, they're in the hospital saying, I'll help you, I'll give you a resource list.
Mhm.
But that was kind of the most they would do is give me a resource list. And I'd have to tell them, yes, I work in the social services system. I'm aware of these resources. I've contacted them, but their wait lists are extraordinarily long. It's not going to help me right now. And I need help right now. So that was
Now,
the
I
thing.
know that you can't talk to the doctors who cared for you during your hospitalization, but there are a lot of physicians who are listening to this podcast. So,
Mm.
if you could talk to them and share a message, what would you say to them?
You have more in common with your patients than you might think sometimes.
Mm.
And it's it's really easy for someone to be in a situation like I was, like all it takes really is one health crisis and you've lost your income, you've lost your job, you lose your housing. And these things aren't the fault of the patient. It's just our again, our systems aren't working. And so it's really, really easy to be in that situation. And I think that's one of the keys to empathy is being able to see that you're not so different from the people you're treating, and that at the end of the day, it could be you just as easily as it was me. So,
Well, Rachel, thank you so much for sharing your story, time, and insight. And thanks again for coming on the show.
all right, thank you.